Okay, continuing on from where we left off on the first recording, this is a diagram of the C-spine. You can see here, this is your canal. So you have your posterior arch of your atlas, your interspinous ligament with your spinous process and your dura mater coming down here. You have your posterior longitudinal ligament, and it attaches to your clivus, so it comes down. Posterior longitudinal ligament and anteriorly attaches to your clivus and comes down. So here's your intervertebral disc. This is your dens, and this is the anterior arch of your atlas. Okay, so this is a MRI sagittal T2. You can see the fluid is nice and bright. Your CSF is bright, so you can see here you have your clivus. Let's get you grounded first, and then coming down, that little black line actually is coming down into your posterior longitudinal ligament. Okay, so you have your spinal cord, which is going to be gray. It's never going to light up with fluid. The CSF will, but your cord will not. So the bright is your CSF. You have your anterior longitudinal ligament. You can see it runs right along the anterior portion of the body of spinous bodies, and you have your odontoid coming up, and you see that little line. That's where your C1, C2 come together. Here is the part I want you to look at here is just your posterior longitudinal ligament, your anterior longitudinal ligament. I'm not going to make you responsible for the others like these. Just so you know, this is how it all fits together. It's all held together by these little bands and ligaments. I won't make you know them though, but I just wanted you to have an idea. So looking here, this is an MRI. It's a special sequence that we run. So this is coronal, so you can see your lateral mass with your odontoid. So this is 2, 3, and you see your vertebral artery coming down. Here is your anterior arch of C1, your dens on your C2, and this is your posterior arch of C1. Here's your anterior longitudinal ligament, your posterior longitudinal ligament. Then you have your intertransverse ligament, and you have your supraspinous ligament and your interspinous ligament. So in between each spinous process, you have your interspinous. On the outside, you have your supraspinous ligament, and then you have your ligamentum flavum that runs in between. So looking here, you have your body, you have your pedicle, you have your lamina, head to the back, and your spinous process. And you have your interspinous ligament and your intervertebral foramen here. I want you to know the disc, and I don't make you know all the different parts of the disc. And here you have your anterior longitudinal ligament, comes all the way down onto your sacrum, and your posterior longitudinal ligament is going to run right down through there. And we have your ligamentum flava here, flava, however you want to say it, and your supraspinous ligament back here between each spinous process. CT, this is a just post-contrast, IV contrast, and this is the disc here. You have your ligamentum flava, and that's about all I want you to know on that. Here is a T-spine MRI, and you have your posterior longitudinal ligament here, and that's pretty good. Here's your posterior longitudinal ligament with your supraspinous ligament posteriorly. Okay, so muscles of the C-spine. This is where it starts to get complicated. So you have your spinalis cervicis muscle with your supraspinatus capitis muscle. You have your splenius capitis muscle, and then your trapezius muscle. Okay, so there's a lot there. Between the multifidus muscle and the cervicis muscle, I don't make you know the difference between the two. So looking at the muscles coming down, you can see where they attach. So give you an idea kind of how it all fits together. So your splenius and your splenius cervacis and splenius capitis muscle. This is what it looks like on MRI. So when we're looking at the MRI, as you can see the MF there, that's your multifidus muscle. Can you tell the difference between that and your the other here on the diagram with your cervacis muscle? You really can't. So if you label either one, I'm fine with it. As you know, it's multiple choice and you'll be able to figure it out. Okay, so SSP, that is your semispinalis capitis muscle with your here. This one is your splenius capitis muscle. And coming out, you have your levator and your trapezius. All right, so this is a CT with contrast, and the thyroid gland is nice and bright because it's uptaking the contrast. You have your sternoclenoid mastoid muscle, which attaches posteriorly by your mastoid air cells and wraps all the way around to your clavicle. So we have your left common carotid and your left jugular, and your splenius semispinalis with your splenius capitis and your longissimus muscle. You have I don't make you know that one. Here's your trapezius and your levator. Yeah, that's pretty good. So this gives you an idea how the muscles come down and attach. So you're going to be looking at these muscles as we go. So we're just studying currently the spine. So as we come down, these wide ones will hit up in the thoracic and in the abdomen and pelvis. Okay, so your semispinalis capitis muscle and your spinalis capitis here, and your longissimus capitis is underneath. So you can see the layers. If this helps you, that's great. That makes me happy. But it's very confusing. So when we're looking at the T-spine, this is a cross-section of all those muscles. We're looking here, this is your vertebral groove, and then we have the splenius muscles, and we have rotator, multifidus, your semispinalis, longissimus, and your iliocostus muscles. So looking here, we have your anterior scalene muscle and your middle scalene muscle, and then we have nerves that run through there. So that little black line that's pointing with the arrow on it is actually a nerve. Okay, so anteriorly, if we start here, this is the subclavis muscle. Then you have your pectoralis minor and pectoralis major on top. Your teres minor muscle, your supraspinalis muscle with your subcapitis muscle there, and your erector spinae muscle, rhomboid, and your trapezius is running along here, and your levator is right there. All right, so looking at your abdomen and pelvis, you have your crus, so your left and right crus. So here's your right, here's your left. This is your diaphragm. This is where it attaches to your spine. So you can see your right crus attaches lower than your left crus. You have your quadratus lumborum and your psoas minor and major, which I don't make you tell the difference, just psoas muscle, okay? Your iliacus and your anterior superior iliac spine and longitudinal ligament here. I want you to know your tensor fasciae latae, that's how I remember. I have to say it like that every time, so you'll hear me say it a million times. Pectineus and piriformis here coming around. Okay, so quadratus lumborum. It's funny how they make you go all the way over there. It's right there. It's on both sides. Here's your psoas muscle on either side of the body. You have your deep layer of fascia. So you're going to see each muscle pretty well, pretty laid out. Latissimus dorsi is in the very back. Here's your rectae spinae, big fat ones here, and that's what keeps you upright. you have layers here. You have the external and internal oblique along with your transverse abdominis. So you can see the different layers on MRI. So Quadratus lumborum, you have your psoas muscles, and you have your transverse spinous muscles and your longissimus muscle and iliacus muscle, and we're going to come out here to your latissimus dorsi. All right, so here's a CT. You can see with the fat in between pretty well. So you have your transverse spinous muscle and your longissimus muscle and iliacus, is that? Yep, iliocostal muscle, and your latissimus dorsi with your psoas muscle on either side of the body. Okay, so this gives you an idea of where all the nerves are coming out. So they come out in plexuses. So here's your brachial plexus. That's your upper plexus. And the one thing I wanted to show you here is your epidural space, and then we come down to your conus medullaris. It's anywhere from T12 to L2. It can be anywhere in there. Then there is your subarachnoid space with the filum terminale coming down, and it actually attaches all the way down to the coccyx. So, and then you have your Cauda equina in through here. So that's how that works. So Cauda equina, or I'm sorry, this is your conus medullaris with your Cauda equina. Your spinal meninges. So we're looking here, we have the body of the vertebra, and we have right here, we have your central root, and we come out here to your ventral root, and your dorsal root come together to your dorsal root ganglion. So looking here, you have the dorsal horn and the ventral horn. And then you have these little fibers, which are denculates, and they anchor it in place. And around that is subdural space, and it has fat in it. So you can see here, this is a CT myelogram. We have the spinal cord in the middle, and you have your little black or little gray stripe there is your ventral root. The black stripe in the back is your dorsal root, and then the thicker part where they merge together is your dorsal root ganglion within your subarachnoid space. And you can't really see well on that one, so I'm going to skip it. So this is a coronal that's angled so that we can see everything well, and you can see your conus medullaris and your pedicle, and you can see your Cauda equina here. This is your psoas muscle on either side. And this is a real good shot here of your nerve roots coming out, your dorsal root ganglion coming out. You see your ventral root and your conus medullaris with your dorsal root. And hard to see on that one. This is down low. As you can see here, we're about L4-5, and we have the Cauda equina. They're just free floating in there. This is your psoas muscle on either side. So your recti spinae muscle, your Quadratus lumborum. Those are the main ones I want you to know. So this little sucker right there, so the basivertebral vein, so there's a vein. It looks like it's cancer to me, but that's actually where a vein runs through the body. And this is your Cauda equina. You can see that the nerve roots are just free floating within the CSF. All right, so this is your central canal coming down the middle. So ventral root and your conus medullaris and your dorsal root, look to see where you're at to make sure that you're in your conus medullaris. And I'm going to stop there, and we'll pick up the rest on the next video.